Hi everyone, my name is Richard Fernandez. I am a doctor of physical therapy in Toledo, Ohio. I work in the outpatient orthopedic setting in a hospital-based clinic. I'm here today on PhysioSage, thinking about difficult and challenging things to teach patients. We're helping people understand challenging concepts. I think lately in our PT culture, we are finding it much more common that although we have all this great knowledge about the complexities of persistent pain, the neuroscience-informed models of pain that are, biopsychosocial or generally more complex, we have patients who are being taught still or have been taught for quite some time a biological only model. And what is our typical response, or my typical response, has been to operate from this writing reflex, as they would call it, let's say in motivational interviewing. My writing reflex is to say, oh, you think that your low back pain is coming from disc herniation or degenerative disc disease, but did you know that most people at your age, they'll have disc herniations and degenerative disc disease, and some of them don't have pain? Great, I educated my patient. Now they should be less fearful and less afraid, right? Well, wrong. Typically, the response to that kind of writing reflex from a therapist is for the patient to have to defend themselves and say, well, no, like I've been having pain for the past 5 years, and 5 years ago was when I had that X-ray result come back and my MRI results come back, and also my neurologist told me why I have my pain. And when you force your patient into a corner that they have to defend these beliefs that you want to help them change, you might actually be reinforcing those beliefs for them, because it's the things the patients say out loud that become the education, the integrated knowledge, and become the things that are reinforced. So what I've been working on lately in my practice is avoiding that writing reflex, asking for permission to share some ideas, but then just saying, hey, why don't we test out some of these ideas? Why don't we do some things that we know are healthy anyways, and let's just see. And that's where I think we really shine in the physical therapy setting, is we can move and we can practice and we get multiple sessions to test these ideas out. And then, super critical, is some kind of ending summary. And my version of that lately has been, hey, is there anything that you learned from this session that you want to make sure we remember? And I listen. And usually all I have to say is, wow, that's a really good lesson. Or I might tack on a little bit and say, wow, that really reminds me of kind of some of these ideas that we're trying to figure out about, is it the disc and is it the degeneration, or are there other things going on? And what does this mean for tomorrow? So leaving some open-ended questions maybe to answer in the next session would be great too, because then we have a little more fuel for what kind of learning concepts we want to focus on in the next session. Well, thank you for this opportunity to reflect and learn on PhysioSage. I hope to do it again sometime. Meanwhile, I will keep enjoying the content here. I hope everyone has a great day.